Dear friends, today I'll be speaking how my SAKSHAM is changing the healthcare scenario in India. What was really bothering me about a couple of years back, that how we can bring a continuity in healthcare system. Now, if you see throughout the India, if you go from metro to the village areas, you will find there's a very hodgepodge healthcare systems. You don't find the right kind of treatment providers, lack of proper skilled people. So I thought probably why not we create a niche in the whole healthcare system, because there has been a lot of discontinuity in the healthcare system. If you go to any healthcare system, you'll find a small percentage of healthcare system comprised of doctors and the nurses. Rest is there's a huge void. So what we did about a couple of years back in 2000, we created a forum called SAKSHAM, a paramedic academy of Saans Foundation. We started, picking up this unemployed youth from the rural India. We started training them, and these people are very young people, and we make them as a health worker. There are two types of health workers we train: the general duty health assistant, what we call GDS. They're the main chunk of the healthcare system, and the emergency medical technician. They're slightly the senior people. They're much more, skill as far as a triage and other high risk areas are concerned. So basically, we picked up 8 pass people for GDS and 12 pass people for the EMTs. Emergency medical technicians. Our whole training system based on 3 things: attitude, skill and knowledge. We believe that until we bring an attitudinal change, we cannot really skill these people. So we did a lot of, we put a lot of inputs. Our team of people started grooming them, and fortunately we got recognition from the Healthcare Skills Council, Government of India. Now, more than 300 people have been employed by us, and they're really bringing a change. The best part of this testing is that these people, they want to do something good because they've been unemployed. They have the rural background, they have the zeal to work. And what we found that it can reduce the healthcare cost. So there are a lot of advantages. First of all, you can empower these people, you improve the healthcare scenario, you can bring a lot of continuity in healthcare, because these people can work at the clinics, the hospital, the nursing homes, and also they can work at the home care level, and also they can play a very important role in advocacy and other initiatives which is very much required in the healthcare society. So our whole endeavor is that to train more and more people, and we have pledged this time to train at least 50,000 people in the next 5 years, and we are targeting different areas, rural India. Recently I found there's Uttarakhand area, there are a lot of people are unemployed youth. They have villages, they are good villages, they have lands and other things, but they don't have the basic money to sustain their living. So we are targeting these people so that they can look after the healthcare systems. And NCR and Delhi, they have a lot of opportunities. They can come down and work here as in healthcare. And healthcare is a very the buzzing buzz is real buzz in the whole healthcare scenario in the whole world. A lot of people in the world are coming to India for a good healthcare system. So we need a lot of trained healthcare workers. Anybody who has an aptitude in the healthcare system, he doesn't have to be very highly qualified. They can come to us, they can log on to Saans Foundation, we can connect to them to the right. It's a very flexi course. Just with 400 hours of training, we can make them as a health worker. They work as an adjuvant. And even in my Saans Foundation, most of the people are the SAKSHAM healthcare workers. They're working with the nurses, and the results are amazing. And these people are not only working, as I told you, as a healthcare scenario, they're working in different community initiatives. So dear friends, if you have anybody who is looking for a job, unemployed youths, and they have an aptitude in healthcare system, send them us. We'll make them health workers. It's a flexi course, 320 to 400 hours, and it is a huge contribution to the society, and most important, we can empower this country. Thank you, and support us with your initiative for SAKSHAM Changing India. Thank you.